Good afternoon. It is a Saturday in December, and we are so excited to welcome back Dr. Miriam Schwartz, who is a gerontologist and an internal medicine physician, to talk with us about the management and treatment of high blood pressure. So she's dedicated her time for us today as the second lecture that she's provided for our line dancing health promotion study. So I'll have you take it away, Miriam.
Hello, I'll be talking about the management and treatment of high blood pressure today. We'll look at the basics about the treatment for high blood pressure, which, for a quick review, high blood pressure is the blood force pushing against arteries, as we have seen in the previous discussion that we had. And the discussion that we had included as well the data or the blood pressure that is considered high blood pressure if it's greater than 130/80, which was based on the American College of Cardiology and American Heart Association guideline. And what I wanted to show is how these are all related, and I have simple videos for them. The first video is about the heart. So let's go ahead and look at that video.
The heart is a powerful automatic pump. It's the part of the cardiovascular system we think of most when we think about good health. But healthy blood and blood vessels are also vital for staying well. The average adult has between 5 and 6 liters of blood, or blood volume. Blood carries oxygen and nutrients to all the living cells in the body. It also carries waste products to systems that eliminate them. Half the blood consists of a watery, protein-laden fluid called plasma. A little less than half is composed of red and white blood cells and other solid elements called platelets. Platelets cause the blood to coagulate whenever an injury to a blood vessel occurs.
When the heart starts pumping the blood will travel across the body. It is when the blood is traveling through the blood vessels that the high blood pressure, which I showed you in that small diagram, is actually focused upon. And let's look at how from the heart, the blood travels through all of the blood vessels across the body. So please bear with me, and I'm going to share with you another video that will show us what that is.
As the heart pumps, arteries, shown here in red, carry oxygen-rich blood away from the heart toward the body's tissues and vital organs. These include the brain, liver, kidneys, stomach, and muscles, even the heart muscle. At the same time, veins, shown here in blue, carry oxygen-poor blood from the tissues back to the heart. From there, it passes to the lungs to get more oxygen to take back to the heart so the cycle can repeat.
So you saw how the blood goes from the heart towards the rest of the blood vessels in the body. When the blood is flowing through the blood vessels across the body, that's what's called the total peripheral resistance. That is, those blood vessels will cause some resistance to the blood flow that is coming from the heart. And it is that area of blood flow, when the blood pressure is really high, that blood pressure against those blood vessels is what is being measured by those two numbers of the systolic and the diastolic. If it is 130/90, then you know that the blood flow across those blood vessels that you saw, it starts in the heart and then in the hands and in the feet. When that is greater than 130/80, then a patient or an individual has a high blood pressure. So what are we going to do about that? One of the things that you have been doing already is increase in physical activity with the line dancing program. And that is a good way of, in fact, having an activity that would hopefully decrease your blood pressure, especially when you are consistent in being physically active with that form of exercise. Losing weight, managing your stress, reducing sodium in your diet, which you've already seen as well with your dietary lectures and examples of cooking Filipino dishes in a healthier fashion with decreased sodium as well as lower fat, avoiding alcohol, tobacco, and illegal drugs, getting enough sleep. So these are all lifestyle changes that can be done to decrease high blood pressure. However, if these lifestyle changes are not effective in lowering the blood pressure medications will be prescribed by your clinical providers. And that's what we're going to talk about today. We will look at the basics of this. These are 5 of the most common blood pressure pills. The first 4, angiotensin converting enzyme inhibitors or ACE inhibitors, angiotensin 2 receptor blockers or ARBs, calcium channel blockers, diuretics or water pills. These first 4 blood pressure pills are used with what's called monotherapy or one medication to control the blood pressure. In some cases, beta blockers are used, especially for the folks who have what's called coronary artery disease. So let's have a look at other types of medications as well, which are less used. However, in some cases, they are used. I have used them in the past in some of my high blood pressure medication resistant patients. Alpha blockers, which affects the peripheral blood vessels, those ones that you saw on the hands and the feet and legs. Centrally acting drugs, this act upon the brain. Vasodilators, this also act upon the blood vessels across the body. And renin inhibitors, which is related to the biochemical pathway of the ACE inhibitor and ARB inhibitor pathway that is affected by those medications. I have here the most common side effects of high blood pressure medicines, and this is in general. And this is probably the reason why some people don't want to take it. If you're going to take a blood pressure pill to decrease your blood pressure, but it causes you to be dizzy, or it causes you to cough, or it causes you to be tired and sleepy, or feeling nervous, and in some men, they will have problems with sexual activity. Or folks will also have some low energy, headache, nausea, vomiting, skin rash, weight loss or gain without trying. These are some of those things that may happen if an individual is given a blood pressure pill. So now we kind of know why some people would resist taking these blood pressure pills. What I wanted to do now is go over each one of these most common medications, what they do, and what are their specific side effects. And again, if I or any of you are given these medications, and if any of the side effects happen, make sure that you communicate with your provider, because there are other options that can be given to you. In other words, there are other choices there that may not cause the effect that you don't like in your body once you start taking these pills. So let's look at angiotensin converting enzyme inhibitors first. What do? They prevent narrowing of the blood vessels. And you may have heard some of these blood pressure pills. Some of them are called in the generic form or name benazepril. The brand name is Lotensin. And this is the reason why I have this chart here. What's the generic name? For example, lisinopril. Brand name is Prinibil. Ramipril, sometimes called Altace. And the question is, what does it do? What it does is it goes through the renin-angiotensin pathway, and it blocks the formation of angiotensin 2. What does angiotensin do? Angiotensin 2 causes contraction of these muscles right here on the blood vessels, and by doing that, it makes it narrow. So if you have this blood flowing through a narrow lumen or a narrow hole, what would happen? The pressure would even be higher. But if you widen that so that there is more space for the blood to flow through, then there is less or decreased blood pressure in that area. Let's look at the side effects of ACE inhibitor. Cough is a big one. Many folks who end up with cough with ACE inhibitor will probably be given a different kind of medication, because that is not a comfortable side effect. And some of those general things that I talked about, the dizziness, the feeling tired, the headache, problem sleeping, can also happen. I had put right here emergent cases. I had labeled it emergent because if somebody is taking an ACE inhibitor and this happens, make sure that you tell your doctor right away. And I would actually stop taking them right away if this happens. If there's swelling or edema in the face, eyes, lips, tongue, or legs, if there's infection, problems breathing or swallowing, you got to stop taking that. Call your doctor and really go to present to the emergency room or urgent care immediately when this happens. Angiotensin 2 receptor blockers, same as its cousin, the ACE inhibitor, it prevents the narrowing of the blood vessels. And the way it does that is it prevents the angiotensin 2 from adhering to the receptors here in the blood vessels. And by doing that, it prevents the blood vessels from narrowing. And so you are then expanding or widening the pathway where the blood pressure can pass through. If the blood vessel is wide, then the blood pressure is not going to be too high as it flows through that lumen. Examples of this are losartan, olmesartan, valsartan, or some of you may have heard of Avapro, Cozar, or Diovan. So let's look at some of the side effects that it has. It also has cough, another general one, headache, sinus problems is specific to it, Dizziness can happen, and some GI issues, the heartburn and diarrhea. And again, similarly, if emergent symptoms such as problem with breathing, fainting, severe diarrhea, or swelling, or allergies to it, such as a lot of swelling of the face, edema of the lips, make sure you let your doctors right away, or you might even have to go to urgent care immediately. Beta blockers. As I said, this is going to be one of those that may be given to a patient as well, but not initially. Remember, the top four are the calcium channel blocker, the diuretic or water pill, and then the two cousins, ACE inhibitor and ARB. So what would a beta blocker do? It will slow the heartbeat and decrease the force of the heart contraction. We saw in the beginning that the heart is involved in all of this. That's where initially the blood is going to be pumped across the body. If there's a beta blocker, it will slow that heartbeat, which is normally 60 to 100, and it will decrease the force of the heart. The heart will pump less blood through the blood vessels as a result. And you can see again, if there is less blood flowing through the lumen here, or the pathway of the blood, then there is less pressure on the blood vessels. Examples of this, I put examples here, again, with generic name and brand name. Carvedilol, you probably have heard of that. Brand name is Coreg. Metoprolol succinate, Toprol XL. Metoprolol tartrate, brand name is Lipressor. And Nebivolol, brand name Bistolic. So again, these are just examples of the beta blockers that may be provided to patients, especially if they have what's called coronary artery disease. Are there
Miriam,
side
could I
effects?
ask a
Yes.
question while you're on that slide?
Yeah.
What would the situation be where someone might be on two beta blockers?
First of all, my question would be, why would somebody be on two beta blockers? Maybe, I'm guessing now, maybe one beta blocker is not enough to decrease the heartbeat. One. Two, if they have cardiac dysrhythmia, such as atrial fibrillation or tachycardia, they may be given two for making sure that the heartbeat goes back to within normal limits. Three, there may be, depending on the dose, some docs I have seen would actually would keep one of the low dose, or if the other one is already on a very high dose, maxed out on that one, then they will give the other one.
Mhm.
So they will have different reasons why they want to give that.
Mhm.
I typically would prefer one beta blocker, in part because I'm a geriatrician, and I would usually start with very low dose of medications, low dose, and I escalate really slowly in the dosage.
Mhm.
So typically I would just give one, unless of course there is a heartbeat issue.
All right, thank you so much.
Yeah. So beta blocker, as I said, quite a number of men actually would prefer not to use this. One of the things that was not written here, because this is actually specifically for women, but I covered it in the common side effects. Beta blocker is notorious for causing erectile dysfunction. And so if I'm prescribing a beta blocker, I would actually disclose to men that they may have problems with sexual activity if they are given this, because they'll come back to me and they're not going to be happy that I gave them something that affected their sexual activity. And I get it. That's a physiological function. And these are some of the common side effects too. Not only can they not perform sexual activity, they will feel tired, they will feel lightheaded, and sometimes they can't sleep, so they don't want to take it. And again, here on the right side are the emergent cases. That if you have chest pain, problems breathing, and in part an answer to Marilyn, one of the reasons I don't use 2 beta blockers is I do not want to cause a slow beating of the heart with double dose of it. In fact, I will never forget, as a young doctor in the Indian reservation, I had a patient who had bradycardia and the reason slow heart rate. And the reason the patient had slow heart rate is because the person was in a calcium channel blocker as well as a beta blocker. Together, it actually caused a very low heart rate. And the person ended up with lightheadedness and dizziness, feeling tired. That's why they were in the emergency room, and I had to take care of them in our family medicine department because the patient belongs in the family medicine department panel. Calcium channel blockers. So that was a good question, Marilyn. I try not to combine the two at all because, again, I take care of older people. So together it can decrease the heart rate so low that they will end up having presyncope or fainting, or they will end up with what's called symptomatic bradycardia, not because they really have symptomatic bradycardia, but because the 2 medications are causing it. Let's look at the mechanism of action of calcium channel blocker. And I get it, though, why they were given both, because initially it was probably difficult to control the heart rate of the person just with beta blocker alone. Because the beta blocker, what was it doing? Decreasing the heart rate and decreasing the force of the contraction of the heart. As we saw, the heart was pumping in that video. Remember? In our little video. With a calcium channel blocker, what does it do? It actually helps contract that heart. Remember the pumping? That is actually made possible by calcium going inside the muscle heart cells and inside the blood vessel cells. There's a blood vessel cells. The calcium would go in there so that they can contract. If you give calcium channel blocker to patients, so then calcium will not go inside the muscle cells of the heart, and calcium will not go inside the cells of the blood vessels either. No calcium, no contraction, no contraction of this muscle cells right here. The blood vessel lumen will remain wider, right? With calcium, it contracts, it becomes narrower. There will be more pressure as the blood flow passes through those areas of the blood vessel. Again, these are just some examples, and I placed it here to jog your memory and see if you've seen it with yourself or your family, relatives, friends. For example, amlodipine, Norvasc, felodipine, that's a generic name itself though, but Adalat and Procardis, nifedipine, verapamil, Verolan, or Callan. Now, let's look at the side effects of this. Similar to beta blocker, feel drowsy, feeling flushed, upset stomach, and this can happen as well, irregular heartbeat. And it makes sense, right? Why? Because it's affecting the muscles that control the heart rate. So it can affect the heartbeat. And if you look at this common side effects, very true. One of the side effects that I see very often is the swelling of the ankle. When I see that in patients, I actually stop this because oftentimes, now that they have ankle swelling and they have heart failure, then the swelling of the lower legs becomes even worse. Then if they cut themselves and they have a wound there, it's very difficult for the blood flow in that area. They end up with infection and then it snowballs. So immediately when any of the people that I look after end up with swelling of the ankles or lower legs from the calcium channel blocker, I stop it and I start looking for something else. Diuretics or water pill. Oh, my patients don't like this, and I get it. But what does it do? It removes extra water and sodium salt from your body. Remember one of those, what they call lifestyle changes that you can do to decrease blood pressure, is to decrease the amount of salt that you eat or we eat. Why? I always remember from one of my professors in physiology, water follows salt. So the more salt we take in, the more water we're going to retain. The more water we retain, the more water we put into this blood cells, right? Stop me if it's not making sense. But what the diuretic would do, or most of my peeps would say, I call them peeps. They're cute. They're my buddies, my patients. They'll say, I do not like that water pill, Dr. Schwartz. Why? Because it removes the extra water. The amount of fluid here decreases, but it has a side effect that my patients don't like at all, which is they have to go use the bathroom to urinate very often because the body, with the help of the diuretic or water pill, is removing water from the body. One of the things we often do is we recommend that they take this first thing in the morning, not at night, because if you take it at night, you'll be up all night going to the bathroom. So we try to change the pattern of when to take it if they're taking it later on during the day. So examples of this are chlorthalidone, which is one of those things that I usually would give. There's also the furosemide, spironolactone, and also there's the hydrochlorothiazide. And according to JNC7, the ACC guideline that I have alluded to earlier, this is one of the 4 for monotherapy or blood pressure, one of the first ones to use. And you're going to ask why? Because it is one of the 4 that is most effective in decreasing blood pressure. How? By removing water from the body, but it does have side effects, and these are some of them. Frequent urination. And now think about it, which I often worry about for older folks, is that if they don't drink a lot of water, and so the more water you remove, then what am I doing? I'm dehydrating them. And so I have to balance and counsel them to make sure they're still drinking water. They don't want to drink water because they got to go to the restroom, but they still need to drink the water so that they don't get dehydrated. So it's really a fine dance. It's really a fine tuning of how much they could drink. Enough so that they don't get dehydrated, but not too much that then they're never going to take the pill because they are going to go to the restroom all the time. Now, oftentimes my hands are tied when patients have lower leg swelling because this is the medication that I have to give and I'm forced to give. In addition to some of those things that are lifestyle changes, such as using some pressure socks or compressor socks, as well as elevating the legs, making sure that at night you can have pillows there to elevate the legs so that the blood flow will go towards the heart. And again, I like to call this emergent cases, which is if you have a sudden vision or eye pain, you've got to see the doctor. Irregular heartbeat as well, muscle cramps or weakness. Some of this can happen. Gout as well. The other thing that is very important with diuretic is the effect that it has on the electrolytes of individuals. So oftentimes, as soon as I start somebody on a diuretic, within a week or two, anywhere from 7 to 14 days, I actually check their electrolytes, such as their potassium, magnesium, their sodium, uric acid, and their glucose. And I make sure that the diuretic is not affecting all of those electrolytes and substances in the body. Sometimes, if you're giving such a high dose of water pill, you may have to supplement them with the potassium. But you need to make sure that you're not overdosing it either. So again, a lot of nuances in this, but it is quite effective in decreasing the blood pressure. Other blood pressure medicines. Now, this is not as common, but the reason I decided to include it here is because there are times when one pill is not enough to decrease the blood pressure. And this blood pressure medicines involve the alpha blockers, which we're going to look at a little bit later again. It affects the peripheral blood vessels, the centrally acting drugs, which affects the brain, the vasodilators, which affects those blood vessels that you saw in the hands and the tummy and the legs, all over the body, and renin inhibitors, which is related or a cousin to the ACE inhibitor and the ARB, or the angiotensin II receptor blocker, because they're all related in that pathway. So let's look at each one of them. And again, why am I including this? Sometimes your hands are tied, and if you still cannot decrease the blood pressure from those monotherapy and then a dual therapy of those, you may start needing this. And I have done this. I have used this. Why? Because we're preventing the folks from having a stroke. Why? Most of the time, and yes, one of the most common cause, if not the most common cause of disability, is stroke. And that is why this physical activity that you're learning from the line dancing is important as a lifestyle change. Alpha blocker. It acts on the alpha adrenergic blockers. Those are receptors that are found in these muscles, in these blood vessels, having those receptors, and it blocks it. When it blocks it, then the adrenergic substances cannot attach to it, similar to what we've seen in the past. If you are preventing the blood vessels from narrowing, what are you doing then? You're increasing that lumen. And when you're increasing that lumen, there is less pressure as the blood flows through that lumen. And examples of this are prazosin, terazosin, doxazosin. Sometimes that's Cardura, Minipress. And you're going to say, hey, I've seen this before. A lot of men actually take this for benign prostatic hyperplasia or enlarged prostate, which helps in the peripheral action on the alpha adrenergic blockers in their genitourinary system. What does that do? To decrease their sense of needing to go to the bathroom or urinating. Does it have side effect? Yes, it does. And its side effect is actually quite, when you're sure looking at the severity of its side effect and the discomfort, it's more discomfort causing than some of the other meds that we saw. The dizziness, feeling tired, feeling lightheaded, vision problems, and again, decreased sexual ability can happen. And as you can see, there's a repeat here of the emergent cases: fainting, swelling of the hands, feet, ankles, or legs, chest pain, irregular heartbeat. And this is called priapism, Sometimes they can end up with prolonged or painful erection in some men. So that's, now you can see why it's not really one of those first choices, because the side effects are not good. Centrally acting drugs. It's also on alpha adrenergic, but this time it's on the brain. It causes from the brain to the nervous system. It's in the sympathetic parasympathetic system. It causes the brain and the nervous system to relax the blood vessels in the peripheral nervous system. Examples of this are clonidine or catapress. I'm sure you've heard about that. I am very tentative in using this. I would not use this as a first-line agent unless, of course, somebody is already allergic to all of those other meds. This is sort of the last choice, if you will. Why? Not only does it have a lot of side effects, but one of the things that happen with this is they have that reflex high blood pressure. In other words, when you stop this, you cannot just stop this, because their blood pressure is going to come back, and it's going to come up with a vengeance. It's going to come back up so high when you just suddenly stop this. So you cannot just stop this, of course, unless it's an emergency case, and you have to have an alternate medication for that, so that their blood pressure is not going to go shoot up. And now you know why I try not to use this at all if I don't have to. But sometimes it may be necessary. Side effects, as you can see, it's a lot again. Just like the peripheral acting adrenergic blocker, changes in vision, dizziness, dry eyes, dry mouth, headache, mild rash, decreased sexual ability again, feeling drowsy or tired, allergic reactions, fainting, skin rash. There you go again, heartbeat, fever, swollen ankle. So as you can see, it has a lot of side effects, and that's why the healthcare professionals try to stay away from it. Vasodilators, hydralazine, and minoxidil. Remember minoxidil? Some folks use that for baldness, to have hair growth. What does it do? It signals the muscles in the walls of blood vessels to relax. And I've used this. I actually use this a lot for two reasons. Sometimes my patients are so complicated, super complicated. As we age, we have more comorbidities. 2, 3, sometimes 4 blood pressure is not enough to decrease their blood pressure. And the one thing that often helps them, and I would give this as needed if the blood pressure is pre-stroke level, I would use hydralazine. Why? It will relax the walls of these blood vessels. Same mechanism. You want to make sure that the lumen here is wide enough so that when the blood pressure is measured in that area, or the blood pressure that the patient feels in the areas of the blood vessels that are narrowed, you want that wide enough so that the pressure is not so high, and to prevent stroke. Does it have side effects? Yes, it does. Upset stomach, dizziness, growth in the body hair, and again, the heartbeat changes can cause chest pain, sudden weight gain, and again, swelling of the hands, tingling, or numbness. And you're going to ask, why do these people get dizzy? Just think about it. Instead of a narrow blood vessel, what are we doing with this vasodilator? Vasodilating the blood vessels in the brain. Remember migraine? Migraine, that's one of the things that happen. That's why some people end up with headache with this blood pressure pills. Vasodilatation of the blood vessels. And remember, you take this pill. When you take this pill, it's going to go all over your body. You're not putting it in. It's not a targeted, okay, Miriam takes this, it's just going to go into her brain. Miriam takes this, it only goes to her right hand or it only goes to her right leg. It doesn't. It's systemic. And that is why one ends up with some of this common side effects. Renin inhibitors, not used often. I leave this to the specialists. They reduce the amount of angiotensin precursors, is what they do. They relax the blood vessels. They're the cousins of the ARB as well as the ACE inhibitors eventually then, or as the outcome, preventing the narrowing of blood vessels. Widening it then so that the blood pressure is not going to be so high in the blood vessels. Does it have side effects? Yes, it does. Quite a lot again. Allergic reaction, fainting, urination, seizures. Again, you probably notice now, wow, that keeps happening. The swelling, edema. So edema is something that one must look out for if you're started on a new medication. And these are the common side effects. Remember, where did we see cough? Its cousin, ARB ACE inhibitor, and it can also have that feeling lightheadedness, upset stomach, another GI, and skin rash. That's the renin inhibitor. Now, I know this looks busy, but there's a reason why I put it here. You probably have seen some medications that are combined, like there's two medications in one. For example, Lotensin hydrochlorothiazide here, benazepril and hydrochlorothiazide, candesartan and hydrochlorothiazide, Altecan. Well, there's a reason that this is out there, is that sometimes one pill is not enough. Sometimes two or three. As I mentioned, I have some patients that I have to give the vasodilator because two is not enough to lower their blood pressure. Again, these are just examples of double blood pressure pills like hydrochlorothiazide and valsartan. This is a water pill and an ARB, angiotensin II receptor blocker. This is a water pill and an ARB, azilsartan. So references, these are from our Government Food and Drug Administration agency, from the National Library of Medicine of NIH. And thank you very much. If you have any questions, I'm happy to answer them.
Well, we did have a couple of our Linda participants join while you were talking, Miriam. So, I'll ask Marion and Lillian, do you have any questions? You can unmute yourselves to ask.
Or
So
I
I
can
have a
ask you
question then.
folks as well. This is just kind of like a Jeopardy question, right? Have you heard of some of these medications like Diovan or Lotensin or Coreg or Toprol? I'll go to the ones that are more common. Is that okay? Let me go up to the top. Cardura, Minipress. Anybody has heard about this?
Mhm.
Here, the water pills. Lasix. Anybody heard about Lasix?
Anybody not heard about Lasix? It's such a common one, huh?
Yeah. And folks don't like it, and I get it, because
Mhm.
it makes them go to the bathroom a lot.
So I have a question, and that is, what's the most important takeaway today for our participants about medication therapy?
To me, when I speak with my patients, I would often think that this patient in front of me is me or my dad, my mom, my husband, my brother. And so if I'm going to be taking care of them, what would be that most important takeaway, as Marilyn had asked? to me, a good control of the blood pressure so I can prevent stroke, but at the same time, none of those side effects. And if there is a side effect, in some people there is, there are so many other options. So please make sure if there is a side effect, don't stop and say, I'm not going to take this because it's got a side effect. There are different ones that could help you. For example, if it's a young man, 30 something, you saw that if I give that young man a beta blocker, they're not going to be able to have sexual activity or it's going to be affected. And that's part of physiological functioning. They probably will not take it. But there's other medications that can actually control that. And so, important thing, make sure that you have the correct blood pressure for your situation. And that if there's a side effect, make sure you talk with your physician and find something else that will not have that untoward side effect so that you can control stroke. I have seen it too often that people who don't have good control of their hypertension end up with a stroke. Not only stroke, but actually micro strokes or ischemic heart disease at the top of their head. You know, it's called microischemic vascular disease. They end up with dementia. Miriam, you had a question, I think.
She wasn't connected to audio, so she's doing that right now.
Yeah.
So while she's doing that, so there's a couple important takeaways that I heard, and that was that we should continue to take our blood pressure medication and don't just stop it because we have side effects. Then the next thing is that we have to talk with our physician about the side effects because there may be other options for treatment. And if we don't tell them, then they don't know and they can't change it for us. But optimally, we want to make sure that our blood pressure is controlled.
Yes, ma'am.
Yeah. Well, and I asked the question earlier about the two beta blockers because I didn't realize this, but when my husband went to the doctors, he put him on two beta blockers, and I'm thinking now we need to ask why,
Yeah.
because it wasn't clear. So I think that seeing these drug names and the side effects, and we'll be sure to send out the copy of the slides and the recording so that people can look at it. Is you find what medication you're on, figure out like if you need to talk with your doctor about stuff because it's not like a one and done kind of thing. There's a lot of treatment options to gain blood pressure control.
Exactly. And these are all from the patient education resources of the government.
Mhm.
So it is publicly available. This is in the public domain.
So Miriam, did you have trouble with your audio? Can you go ahead and type your question into the chat?
Marilyn, I'm going to dovetail again to your question. I think it's a great question. Actually, I want to add a third one. The third one is related to the side effect, right? Some people will say, and I think Dr. Felly's talked about this too in the past, which is hypertension oftentimes is asymptomatic. So you feel better without the drug, without the blood pressure pill, than with it, right? So people will say, why would I take the medication if I feel okay with my high blood pressure? So then, related to what you said, Marilyn, you got to take your blood pressure still and then talk with your doc if you really have that side effect because there is a menu of blood pressure pills out there. And sometimes you are gonna put double medications because they have different mechanisms, as you saw here, right?
Mhm.
One can remove water pill and some can decrease the heartbeat. But yeah, as far as the medications that would affect the heart beating, I try to stay away from that together. Unless there's a good reason.
Yeah. Well, we have to find out the reason. So
Yeah.
that'll be a question for the next trip to the doctors.
That's the homework. Yeah.
Yep.
Miriam. There's the chat. Sorry, Miriam. She has a problem with her audio.
Right. I asked her to try and put her question in the chat, but I haven't seen it come through. Lillian, do you have any questions or any comments?
The one thing actually that I wanted to do as well is there are some good public service brochures from, say, American College of Cardiology, NIH. This is FDA. This is, it's really good. I was going to send it to you, Dr. Knight and Dr. De La Cruz, maybe when you see our participants again. If you're going to meet again, you can give that to them or even email the link.
Yep. Well, we'll be back in person on January 6th, so we can, provide any handouts then. And we have everybody's email, so we can also provide links for them to, look it up, on their own, and then they can bookmark it on their computer. But yeah, absolutely. Send it over and we'll make sure we get it shared. So not seeing any comments in the chat or questions, I'm going to suggest that we go ahead and wrap it up today because believe it or not, it's almost an hour that you've been talking, Dr. Schwartz. It just went so fast.
Sorry.
No, don't be sorry. There was a wealth of information in here today that I think is really helpful for our participants, and it was helpful for me. I learned some things too. So, um, you know, we'll go ahead and wrap it up if we don't have any questions.
Would they like to see that last video that I had, Marilyn, showing how the
Sure.
blood is having a hard time going through a narrow pathway?
Oh, that would be a great idea. That would be a good way to end.
Okay.
Because you've talked with us about those medications that prevent the blood vessel from narrowing so that it won't, increase the pressure.
Yeah.
So that would be a good one to end with, I think.
Okay. And narrowing can be caused by cholesterol. Remember, our participants were taught about healthy food. They were taught about how to cook good Filipino food with healthy ingredients.
Mhm.
So they're going to see right here how, if we have cholesterol, the cholesterol will actually narrow the lumen of the blood vessels.
Sure.
And you will see right here. I actually enjoyed this video. So let me stop sharing this. I'm going to find that video. Please bear with me.
Sure. That sounds good.
Normally, the walls
We can hear it pretty good,
You can hear it?
Miriam.
Okay.
Yeah.
Here we go. This is a good one.
Atherosclerosis is a disease in which fatty material is deposited on the wall of an artery. Normally, the walls of an artery are smooth, allowing blood to flow unimpeded. However, If damage occurs to its inner lining, fat, cholesterol, platelets, and other substances may accumulate at a damaged section of the arterial wall. Eventually, the tissue builds up and a plaque is formed, narrowing the lumen of the artery. Where the narrowing is severe, there is a risk that the vessel can become blocked completely if a thrombus forms in the diseased segment.
So that shows how denarrowing because of cholesterol can actually cause more blood pressure problems if we had high cholesterol. They're interrelated. And that's why what was taught to our participants was very helpful, not only with the increasing physical activity through line dancing, but with good, healthy eating, with good cooking. And this is why they're so interrelated.
Mhm. You know, one of the things that has come up during our discussions is, you know, we had a potluck before we broke for the holidays, and so some of the questions were, could we bring fried food, or could we, if we're going to make adobo, we're going to make it the way we always have done. And so, one of the things that occurs to me is that, when we have like special holiday sorts of treats, we want things to be, delicious. We don't necessarily think about being healthy. And so, doing things, and I know that all of our speakers have said this, like, do things in moderation. So, if you're going to, go out and buy Jollibee, for example, you're going to enjoy it. It tastes good. It smells good, but don't eat it every day. If you're going to make, your special adobo, and you don't want to cut down on the salt and fat, you could do that at, Christmas time, but the rest of the time, try and, put those things into place that have, low fat, low sodium, low sugar in our diet so that, we're preventing this from happening. That's a very good visual, and it's a little scary as I'm looking at this, as the narrowing of the blood vessels, gets to the point where nothing can go through.
Exactly. Exactly. You nailed it on the head. One of the things that I would actually do with our adobo is I use olive oil and I remove all the skin. And then later on, when we eat it overnight, if you put it in the fridge, the next day, if there's anything white stuff at the top, I scoop it out. It still tastes great.
Mhm. Well, Dr. Felly found some really good tasting pancit and the vegetables. I can't remember what the name of those sauteed vegetables are, and they're low fat and low sodium, and they're delicious, you know?
I need to taste that one of these days. I'll
Yes,
go
you
over
do.
there and bring some baon.
Well, we're going to do some focus groups, so we'll make sure that we do one on your day off, so you can come and taste some of these things.
Yeah, and I'm happy to repeat this if need be,
Yeah.
because
Well, we
it's
thank
already
you so
said.
much.
So
Yeah. This was a great learning opportunity, and I'm happy that, you agreed to, do it for us, close to the holidays on Zoom. So thank you so much for doing that.
thank you. Zoom is great, very convenient. So thank you, everyone. Merry Christmas, everybody, and a Happy New Year. Healthy, Happy New Year. Get those
Yes.
plaques out. Thank you.
Okay. Thank you.
Thank you. Thank you. Thank you.